there's a thing, isn't there, in the veterinary profession that the exciting stuff is surgery and the boring stuff is dermatology, because all you ever give is steroids. But I know that's not true. So tell us about steroids. Sorry, tell us about dermatology.
No, I suppose my interest in dermatology probably started over in the UK. So just I suppose even a simple thing like otitis externa. I got into a habit because what was generally done in that practice was that you would give Cerelan at the first presentation. Now we were very good in terms of doing cytology, so as long as it was cockeye or malassezia, you would give Cerelan, and then at the you didn't necessarily schedule in a recheck, but if the dog came back within an arbitrary amount of time, we'll say 3 months, and then generally you would use say a more potent proprietary ear medication.
Mhm.
And anyway, I got offered, I got the chance to go to CPD. It was by none other than Sue Patterson, and she talked for
Oh, fantastic.
it blew my mind. I'm gonna be honest,
Brilliant.
but absolutely blew my. So
Yeah.
she honestly spent around 90 minutes talking about ear cleaners, and I was on the edge of my seat. I just couldn't believe it. I was like, how can there be so much
Mhm.
knowledge about ear cleaners? I was waiting, and I went up to her afterwards, and I had to thank her for it. I still, of all the CPD I've done, I still have saved that whole folder from that event. Absolutely phenomenal, and that kind of stimulated my interest. And then by the time I got back to Ireland, I was more interested in trying to be really exact. So if I saw such and such underneath the microscope, what was the best medicine to use?
Mhm.
And then after that, once I in the current practice I'm in, like it's just in one site. So I know the clients very, very well. I know the patients very, very well. And it really struck me that you'd start seeing the same pattern where like in the late spring, this dog would come back and it would be, a month or so either side, but it'd come back again with otitis externa. And then
Mhm.
from there, I just started to think more and more about the environmental allergens. Then my mind got blown when I realized about things like food allergies. And then I started to kind of go down that rabbit hole, and I just wanted to know more and more and more. And then I wanted not only to know what the triggers were, but then how could you potentially manage a patient so that even in the presence of triggers, could you stop them from flaring into a full blown infection? And then I started, I, you have to be a little bit careful. Like sometimes owners don't necessarily have the same enthusiasm that you do. So sometimes
Mhm.
I'll be on regular consults and there might be a new client who just happens to have booked in with me, and I deliberately don't tell them that I'm a dermatologist because I just want to keep it really simple at the start and see just how much interest there is. And if there is, then yes, brilliant. And what I do is I'll generally kind of send them an email with some information so that if it's too much, that they have a chance to maybe digest it over the weekend. And if there is an appetite, then go ahead. So I did my cert with University of Liverpool, and like all of the certs, like that opportunity to delve into the evidence, look to see, what I suppose what works and what
Mhm.
doesn't. Um, that was fantastic. And now at this point, now I do routinely, like as long as I suppose this, if you've got the right patient, I'll do food trials. They're incredibly rewarding, especially if like
Mhm.
one of the most successful ones was kind of an older dog around 6, 8 years of age who had chronic otitis his whole life, and it responded to the food trial. Now it took a while to get to the owner there because he was still giving sausages, and I was like, I kept saying to him, I was like, no, anything can trigger
Yeah.
food allergies. You need, like, I want this to work. So please, like, just give me 6 weeks where you just don't feed anything other than this prescription diet. That's the only thing that should cross
Yeah.
this dog's lips.
That
Anyway,
prescription diet and water, nothing else. What? Not even a cup of tea and a biscuit for
yeah.
the morning? No, especially not the cup of tea and a biscuit.
Well,
Yeah.
we did the re-challenge with this dog, and it turned out that within 2 weeks of being fed sausage, the ears flared up. So I actually didn't hear anything from that man at all, and I wasn't sure because
Mm.
the dog would come to you when it was in a full blown ear infection. It wouldn't just come if they were seeing a sensation of itch. And anyway, around Christmas time, one of my last consult booked in, uh, Darragh, this owner wants to see you. And I was opened the door, said, "Come on in, like it's a ear infection, is it?" Like, and he was like, "Nope, I just wanted to give you a Christmas present. Look at him, he's perfect." And I shook his hand,
Wow.
looked down the ears, and I must say it was brilliant. Like to think that something simple, and the greatest thing is like there's no need really for me to get involved after that point. And I'm just delighted to think that this dog now has gone many, many years doing well. The other thing I do